Hello viewers, welcome back to Adorable TV channel, and today we'll be discussing about qualities of a great nurse. We know that nursing is a career and also a call. Like to me, I feel is a call, not just a career. It is something that has to do with your whole being, like a whole of you. Because once you've decided that you want to be a nurse, it has to be a whole of you going into nursing. It's not like half of you going in and then the rest of you are somewhere. So it's much more than a career. It's a calling, and then it requires a special set of skills and personality traits to be able to do it. Now let's move into the some of the qualities, because I'm not going to mention all, but I'll mention but a few. So one of the qualities is communication skill. Before you be a nurse or before you become a nurse, you must be able to communicate, able to relate. You must be you be able to speak English, because this is something that is generally be used by everyone. So you have to be able to communicate with people in English or maybe in a local dialect, depending on where you are working. So if you're not able to communicate well, if you're not able to arrange your statements well or sentences very well, then it will be difficult for you to be a nurse, because there is a time that requires for you as a nurse to speak out, like to advocate on behalf of the patient. So if you're not able to put in words together, you won't be able to defend your patients adequately. So your communication skill has to be well improved. So the next is caring. For you to be a nurse, you must be caring. You must be able to help people in times of need. You must be able to render help to people in times of need. Like, let's say a patient that is bedridden and is not able to go to the bathroom for maybe to wash, take his or her bed, or go to the toilet to defecate. You will have to set bedpan for this patient to defecate. You will have to be the one to bathe this patient on bed. You will have to be the one to feed this patient. So if you are not able to help, then you won't be able to do this. You won't be patient enough to do this for your patient. So for you to be a nurse, you have to be ready to help, ready to care. That is it under that, because if you do not care about others or about yourself, then nursing is not for you. You won't be able to be compassionate enough to provide that quality care to your patients. Then another point there is empathy. We know most times we confuse empathy with compassion, but it is very, very, very different. When we talk about empathy, this is your ability to hear, listen and share in patients' feeling. You'll be able to listen to them and also share in their feelings, in their problems. You have to be able to do that. Being empathic doesn't mean that you have to cry when the patient is crying. No. When you do that, you are sympathizing. You don't sympathize as a nurse. Instead, you have to empathize. Share, put yourself in your patient's shoe. You are the one feeling what the patient is feeling. But doesn't mean you should cry that because the patient is crying. No. So you should be able to, you have to be compassionate enough because when you put yourself in their shoe, you will be able to help them when the time comes. You'll be able to provide adequate care, quality health care to your patient. So you have to be empathic enough. Then in being showing empathy, you don't have to agree to whatever your patient says. No, you don't have to always agree to what they say or their relatives. No, sometimes you have to agree for them, sometimes you have to agree with them, but not always. Sometimes you have to bring up a nice idea or a better way to see that the patient sees reason with you for doing what you're about to do or you've done. So in this case, you always try to internalize the pain and suffering of your patient. This will help you to render a quality health care. So the next one is you have to pay attention to detail. If you are to care for a patient, even though that we know that you've studied, you've gone to the university, and then you are knowledgeable in most of the things, but if like there is a plan of care for your patient, you'll be able to get details about the care. In medicine, you have to use detail to work. If they say give, like for example, they ask you to give digoxin. I know that in giving digoxin, if a patient's pulse is low, you don't have to give it. If the heart rate is low, you don't have to give it. So if you know the detail about digoxin and you are asked to give it, and you notice that this patient has such condition, you'll be able to relate with the doctor, and this will help them to be able to render a better care, or maybe change a plan of medication. Work with detail. If they say dress the wound by 8, dress it by wound. If they say serve medication by 7, serve it by 7. Do not alternate it. Do not like maybe carry over, let's say because you didn't, maybe you were too busy, you were unable to give it by 7, then you decide to maybe to give it or not to give it at all, another. So you have to pay very much attention. You have to be like attention oriented. That is the one of the qualities of a good nurse, because this will make sure that you follow instruction, adhere to instruction strictly to provide a better care for this patient. So the next one is problem solving skills. Problem solving skills. You should be able to detect where there is a problem and solve it adequately. You should be able to know when something is deviating from normal and prefer a solution to it. You don't have to wait for someone to come around before you be able to do something for your patient. No. Like I remember, for example, I was on a shift, and then patient had a temperature spike. Like they had a high temperature. The fever went up. So the doctor wasn't around. But because I'm knowledgeable and I have these problem solving skills, I was able to prefer a solution to it instantly. Because I was aware that this patient, okay, I know what to give for the temperature to come down without even waiting for the doctor to come. All you need to do is call the doctor, inform the doctor, okay, see, and I've given so thing. You mustn't wait for the doctor to come sometimes to take like some actions. Even though it is necessary for documentation, you have to also document whatever you do. So if a need comes for you to act in the absence of a doctor, you have to do it. You should be able to act. You mustn't wait for the next, maybe your co-workers to tell you what to do. You have to act when the need be. You have to be able to have an excellent judgment skills. Like you can be able to think quickly on what to do. You anticipate, okay, if we do this like this, it will come out like this. If we do this like this, it will go wrong, or it will be the best solution for the patient. So you should be able to think fast and act fast. That is when you have these problem solving skills. So the next is respect. You can only earn respect by giving respect. You don't expect to be respected because you're on uniform, you're on white, when you disrespect your patients or co-workers. You should be able to respect both patients and their relatives, your co-workers, and every other person around. You have to respect, because when you respect, it will give you an edge. It will also help you, like for your patient to listen to you when you talk. But when you don't respect them, they'll be like, what is this one saying? This rudeness, this, that. You don't have to be rude. You don't have to be rude. So you have to be very, 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 very respectful. Because once you respect your patient, it will help them to give you that maximum cooperation to be able to like do things that will help them recover fast and better. So you have to respect your patient, both the lifestyle, patient belief, patient religion. Even if you're not of same religion with the patient, don't say because you are a Muslim and the patient is a Christian, you won't respect. No, you have to accord them that respect. If they want to pray, allow them to pray. Allow them to pray. Don't interfere in their religion. Don't interfere with their decision. What we do in nursing is provide patients with maximum options. Then you allow them to make the decision. You don't make decision for your patient, except when the need comes. Let's say maybe the patient is unconscious and all that. Even before that, you have to take permission from the patient. That is a way of showing respect. You take permission from the patient before carrying out any procedures. You don't go straight into doing anything without informing the patient. No, you have to accord them that maximum respect. If a patient says don't give me injection. Don't object to it. Don't go ahead and give it when the patient says no. Because once a patient believes that, oh, if you give me the injection, I will die, I'm telling you, there's possibility that when you give this injection, that patient will die. Because that is the patient belief. So when a patient says no, respect the no. When a patient says yes, respect the yes. Don't go contrary to their decisions. Don't go contrary to their belief, to their religion, and their personality. Not because they are poor, from a poor home or background, they are not able to pay their bills, then you respect and you disrespect them. No, do not disrespect your patients. Like I said, you gain respect by giving respect. So the next one is decent dressing. Yes, you have to be very, very decent. Do not dress to kill. Do not dress to seduce as a nurse. You have to be decent at all time. You have to be neat at all time. You shouldn't wear a strong perfume. When you want to use a perfume, use a mild one that will not irritate your patient. Because most times there are patients that their conditions, most times when they perceive some certain things, they tend to vomit. So you don't have to put on a strong or harsh perfume on your clothing. You have to be neat at all time. Dress properly. Dress neatly. Dress decently. Because most times you attract maybe a patient disrespecting you by touching you like on any part of your body because you did not dress well. Most of the time, what you wear on your body can seduce a patient, and the person will be tempted to touch you the way he or she is not supposed to. So you have to always dress decently at all time. Do not dress to impress. Do not dress to impress. So the next one is self-awareness. You have to know yourself. You have to know yourself. You have to know if you are the type that like working like in a noisy environment or in a quiet environment. If you like working in a quiet environment, you cannot be an accident and emergency nurse. You cannot be a pediatric nurse. You cannot be a midwife, and so on and so forth. Then if you are the type that like quiet and cool environment, then you have to go for something like maybe let's say inpatient nurse, such as you have gerontologic nursing, you have even psychiatric nursing is noisy. So if you are the type that like, just try to identify yourself, know what you want and what you cannot do. So what you are able to, when you're able to know yourself and know the kind of environment you can work in, it will help you to choose your profession better. It will help you to choose your specialty in nursing better. So always know what you want as a person. Always be conscious of yourself. Always know when it's right to talk and when it's not right to talk. Be self-aware. Know when the condition demands for you to act. Know when the condition demands for you to be calm. Don't always do things for doing sake. Be self-aware. Always know when, like for example, let's say you are working down the street and then emergency case comes up, like maybe someone had an accident and all that. You yourself know that, and the place is bloody. You know that as a nurse, looking at some of the diseases around like HIV and all that, you don't just go helping because the person is in pool of blood and then you end up endangering your own health. Your health, if you don't like, if you're not sound, you won't be able to provide care for another person. So you have to know when to act and when not to act. Be self-conscious, be self-aware. It will help you to be more productive in your career. So the next is God-fearing. God-fearing. You have to be God-fearing. Definitely, you have to be God-fearing. Like, you have to like be able to pray when the condition or when the need arises. You have to be able to intercede on behalf of your patient. You have to be able to do things that will help your patient recover spiritually. So you have to be God fearing because this will help you to encounter some of the hurdles in nursing. Then, the last but not the least, you have you should have this desire to keep learning. Have the desire to keep learning. Nursing is a continuous process. It's not something that you just graduate from school of nursing or university and then you feel, oh, I'm done with studying, I'm not going to study again. No, in nursing, you study every day. In nursing, you keep reading. You keep updating yourself in new trends. It's not something that you do and then you stop. You have to know when you have to go for studies, go for some of the trainings that will update you on the current trends in nursing. You don't need to just stop at there because you've graduated with your certificate, so no need going for a higher education or acquiring more knowledge. No, in nursing you keep reading, you keep studying. So if you don't have the desire to keep learning, then I'm telling you, you won't be able to give that quality health care to your patient. You must be curious to study. You must be ready to learn new things. You must be ready to advance your knowledge and career. So if you have the desire to study, the desire to acquire more knowledge, this will help you to provide a better care for your patient. So these are some of the qualities of a great nurse. So there are so other qualities. There are so many qualities you can mention. Well, today I'll just mention about a few of these. So thanks for watching. Keep tuning in for more videos on Adorable TV channel and stay tuned till we see ourselves again.